Everyone.
Hi, everybody.
Welcome to another live. I am Dahlia Marin, registered dietitian nutritionist.
I'm James Marin. I'm an integrative registered dietitian, environmental nutritionist. We are the owners and founders of our private practice, Married to Health. We are coming to you today to discuss a very, very important topic, of course, as it relates to gut health and more specifically SIBO and IBS. We're getting things going a little bit here, so wonderful to see you all.
If you haven't tuned into our past lives, we encourage you to go back. You can watch them. They are on YouTube. They're saved on our YouTube channel, Married to Health. There we've presented various topics on SIBO and IMO, intestinal microbial overgrowth. So we've talked all about why someone might get SIBO or IMO, who you might consider to be on your care team for SIBO or IMO, and different modalities that can be utilized to diagnose SIBO or IMO. So if you haven't seen those, we encourage you to go back, check them out. We do go live in our private Facebook group. So we do have a private Facebook group for those working with us for their SIBO or IMO. And in there, we actually will answer questions. So you might hear us answer questions from our group members. If you wanted to get our opinions and you wanted us to answer your questions, you can always consider working with us. You can go to our website, Married to Health, to learn how to do that and learn how to do more. So we see your other questions come through and we'll answer those from our group.
Yes. All right. So yes, amazing day. We've had an amazing week. We've had lots of patients this week. We've had lots of meetings. We had a great meeting with our team. So we're in a good mood, right, Dahlia?
We're always in a good mood. It's always a good day.
It's always a good day.
I always like to remind myself when I have a lot on my plate, I am blessed, not stressed. And that really helps turn things around and helps give it a positive spin. So I'm feeling very blessed this week.
Yes, for sure. So wonderful to talk today about bladder issues as they relate to SIBO and IBS. So a lot of times, like what we try to teach with our patients is the fact that things are connected. So it's important to understand it's not just SIBO, right? It's not just irritable bowel syndrome, right? IBS. There are a number of pathways that are interconnecting and all working together to help or to not help, right? Or to cause issues in your body. So it's not just, one specific compartment that is not connected to anything else. The only reason why we compartmentalize, especially with chronic disease, is so we don't get so overwhelmed, right? We label something IBS, we label something SIBO, we label it IBD, right? Inflammatory bowel disease. And we compartmentalize it so that we can handle it a little bit better. But it's important to realize it is all connected at the end of the day. So what we seem to find most definitely is a lot of our SIBO and IBS patients also complain of bladder issues where they have trouble holding their urine, they wake up frequently during the night to urinate, and the list can go on and on.
This is always a question that I like to ask my patients and those with whom I work. I always ask, are you that person who easily will pee their pants? And this is for a couple of reasons why I will ask that.
We always, everyone asks that question, right?
So this can be kind of twofold, right? We know that if you have pelvic floor issues, you might be that person who might pee their pants pretty easily. So I have my patients who, they might be a very small person. They might be 100, 110 pounds, and they'll say, I've had 4 pregnancies and I birthed, pretty big babies, 7, 8, 9 pound babies. Not that 7 or 8 pounds is a big baby, but for somebody with such a small frame, having that pressure on their pelvic floor can definitely put a lot more work on it and can weaken it to a certain extent. So I will ask that question for that reason. And I also ask that question because sometimes my patients will resonate with it and they'll say, yes, I pee my pants a lot, or I go to the bathroom so often. And I'll ask, okay, is it related to your water consumption, your hydration? And if they say no, I'll ask often, if you even have to pee a couple drops, does it feel like you're going to pee your pants and you can't hold it at all? And anytime my patient says, yeah, actually that is what's happening to me, I often have to pull over if I'm driving. I have to know where the bathroom is all the time because I feel like I'm going to pee my pants and it feels so urgent, but I go and only a few drops come out. And that's when I'll say, okay, there might be something to this. And we know that there is a higher prevalence of this when it comes to SIBO or EMO. And, let's kind of take a step back. We want to talk about what the bladder is. So the bladder is a hollow muscular organ that stores urine. And it can expand when it's full. And then when that happens, nerve signals in the bladder tell your brain, time to go potty. It's time to urinate now. And this is communicated through our pelvic nerves. So again, one might have pelvic floor dysfunction. One might have misfiring of their pelvic nerves. And then that triggers this over-signaling. So with interstitial cystitis, sometimes these signals get mixed up, or sometimes they might overfire. So that's when I'm saying that sometimes my patients will say, I only have to go a couple drops, but I feel like I'm going to pee my pants. It's overwhelming. It feels very urgent. And it's something that is very bothersome, if you can imagine.
I can't imagine. Thankfully, I've never dealt with these issues, but I can only imagine how just inconvenient this is. And already when you're dealing with SIBO or IBS or other issues, you have to be next to a restroom for, fecal issues. And now you're having urinary issues on top of it. It can be a nightmare. So yeah, I can totally see that. And we see this a higher prevalence with diabetic patients. We see this with patients, there is correlation with omega-3s in your diet. So like I said, there's many little roots connecting to these big root problems that you're having. So a lot of these things play into, and that's what we work with our patients on, kind of identifying what we like to call the low-hanging fruit that you can modify and change, as well as getting to the deeper roots. But yeah, it's setting a nice stage. So you have an idea of what's going on, the bladder and what it is and how it connects to that pelvic floor.
And sometimes it's temporary, because we know sometimes it's stress related. Sometimes when you're under more stress, you might be producing more adrenal hormones. This can cause your body to want to urinate more often because of something called vasopressin. And there are several different hormones that might go into you urinating frequently. If it's temporary, you don't want to suddenly jump up and say, I have interstitial cystitis. Usually it is going to be diagnosed if the symptoms are lasting longer than 6 weeks. And again, this sometimes is referred to painful bladder syndrome as well. So it can be called interstitial cystitis, inflammation of the inside of the bladder, or painful bladder syndrome. And so if you have pain, pressure, discomfort with urination, or if with the feeling of urination, again, if those symptoms last longer than 6 weeks, it's something that you want to consult with someone with. I usually will say probably start with a gynecologist. They might refer you to a urogynecologist who specializes in the bladder. They might refer you also to pelvic floor therapy. But typically we find that there are flares experienced during times of menstruation. So one might experience a flare and you might be having more chronic symptoms and more frequent symptoms around the time of menstruation. Sitting for a long time also, because it kind of just puts pressure on those pelvic floor muscles. That can sometimes trigger this for people, where they'll recognize, if I'm standing, I feel a little bit better. When I'm sitting, these symptoms are a lot more present and more prevalent. Stress, like I was saying, because stress can make all of us feel like we have to pee more often. So stress can exacerbate that, especially for somebody with this diagnosis. Exercise, because again, we're putting pressure sometimes on those pelvic nerves or the pelvic floor muscles when we are exercising. So that can be an instance. And sexual activity. Sometimes this increase in pain is found during sexual activity. And, some of these signs and symptoms we can review. You might have pain in your pelvis or in that perineal area, the perineum, which is that little piece of skin, that little space between the anus and the vaginal hole. So some might experience some pressure there. For females, of course, males aren't going to have the same anatomy, but they also still have a perineum. So that's still an area that can.
And there's slang terms for that, the perineum.
Chronic pelvic pain, that persistent, urgent need to urinate. And some might even say that they go up to 60 times a day. So again, very frequent, very small amounts can also be urinated. You can also have chronic yeast infections with painful bladder syndrome or with interstitial cystitis. Chronic yeast infections, chronic UTIs, chronic and recurrent bacterial vaginosis are also things that are sometimes experienced. And we know symptoms can be mild, they can be intermittent, they can be constant. A lot of the feedback that we hear from our patients who know that they have SIBO or intestinal microbial overgrowth, IMO, they'll say if their gut is in a flare, their bladder also tends to be in a flare. And remember, those microbiomes, your bladder has a microbiome, your gut has a microbiome, and they really can communicate.
They do. And then, so there's mesentery systems, there's physiology in the gut that helps things communicate. Also, we know that you're making, if not all or most of your short chain fatty acids in your colon. And these short chain fatty acids get carried out to other organ systems. And so we know that happens in the pancreas, and more and more research is coming out where we would assume that it's happening in the bladder as well. These short chain fatty acids work all over the body. And so it is associated when you're having gut issues like irritable bowel syndrome, other chronic diseases like fibromyalgia or chronic fatigue syndrome, chronic pain syndrome. It's almost actually really a short chain fatty acid deficiency, really, like at the end of the day. It's an inflammatory response because you are lacking the key chemicals or molecules like short chain fatty acids to help decrease this inflammation. Interesting enough, the perineum is also a big factor. There's actually a lot of studies, and one very, very popular that recently came out, and it's more related to environmental health and environmental toxins, where they measure the perineum of newborn babies. And so what they're finding a huge correlation with maternal and fetal exposure to toxic synthetic chemicals, and it altering basically the sex physiology of these babies. When we're altering the sex physiology, you may be altering the anatomy to make you more prone to yeast infections, to make you more prone to bladder infections, to make you more prone to having a shorter perineum, and therefore altering your physiology and anatomy. So really, really cool stuff. And we do know that these synthetic chemicals can alter your microbiome or microbiota, right? We know it alters the microbiota of the soil. We know it alters the microbiota of the food. It only makes sense that it alters the microbiota of us, because we are all connected in that cycle. So many connections here, so much going on. But at the end of the day, it's like, okay, what the heck do I do? What is this?
And who's at risk? I think that's important also to know. Are you at risk for interstitial cystitis? You might be watching because you're like, this sounds familiar. It's not extremely common. Studies have shown that it's estimated to occur in 3 to 8% of women in the US, anywhere from 2 to 3% of US males. So not extremely rare, but also not super common. But if this is resonating with you, then we'll talk about, like James was saying, reasons why it might happen. And, who is someone that's going to be a little bit more likely. Why are we talking about this? Again, there's correlation with SIBO, IMO, and interstitial cystitis. There was, I know it's dated, but a 2008 study. There hasn't been a lot of emergent studies on this because it's just not as prevalent. But a 2008 study showed that 21 patients studied, about 81% of them who were picked for this study because they had symptoms, had an abnormal SIBO breath test. So we know that a majority of these 21 people who registered for this study had risk for SIBO or IMO. 15 of those patients were treated, and they had moderate improvement in their GI symptoms. About 73% of them improved GI symptoms, and about 40% of them experienced improvement in their interstitial cystitis symptoms. So again, the people who were acquired for this study were those who said that they were having bladder issues and also were having gut issues. So there was that high prevalence of overlap with those who said, yes, I have bladder issues. Yes, I have gut issues as well. They were found to have improvement in both SIBO and interstitial cystitis with treatment. So again, if your microbiome is irritated, if you do have dysbiosis, which, like we've talked about, can be one of the roots of SIBO and IMO. If there is more of that inflammatory microbiome that's living and residing within you, then that's communicated to your other microbiomes. That's why you might find your skin is flared, your bladder's flared, other areas are flared.
And really there is that correlation where if you are having an inflammatory microbiome, chances are you are not getting the key molecules you need to put out those fires, right? Inflammation is Latin for inflames or on flames, right? That's essentially what's happening. Inflammation isn't bad. However, we need inflammation. We use inflammation, but it's important to understand we don't need it all the time. It's just like keeping the stove on. Yeah, it's great to have your stove on. You want to cook your food and heat your food, but you don't need it on 24 hours, 7 days a week, right? You're going to waste gas. You're going to potentially burn your house down. So that's essentially what's happening. At the same time, with your gut microbiome having those issues, you are going to most likely be lacking in omega-3s. And omega-3s are vital. They're essentially what make up that encasing and that insulation of your neurological pathways. And so we're talking about those sensors on the bladder. We're talking about the nervous system. We're talking about nerve signaling. You are most likely going to be lacking in those omega-3s that help with your nerve signaling. So you're getting a double whammy effect. So it is not good.
And honestly, and this is very, very anecdotal. This is just my patient experience. And I'm someone who sees SIBO patients day in and day out. But I have had a lot of my patients who have emo and interstitial cystitis tell me that they previously were on a raw vegan diet or on a high raw diet. It might not have included a robust amount of omega-3s. And I'm not hating, I'm not saying a raw diet's impossible. It is very difficult to manage all of your macro and micronutrients on a raw diet. It's not impossible, but it's difficult. So if one is not extremely diligent with adding in flax and chia, walnuts, those raw omega-3 sources, avocados on an adequate basis, that might preclude some of that nerve dysfunction and that nerve misfiring, which we see here. And again, not only do the nerves play into this, but that leakiness, right? And so we've now finally started to all really embrace leaky gut. 10 years ago, a lot of people would say, oh, leaky gut, that's quackery. There's no data to support that. Yeah, there's no such thing as leaky gut. We even heard this as recently as like 4 or 5 years ago from gastroenterologists and other practitioners. So finally, we're starting to acknowledge that leaky gut is a thing. And so just like you have that microbiome within your gut, you can have possibly leaky bladder, right? We know that inflammation can break down the protective lining. It can break down that epithelium, that tissue that's really lining these different systems.
Right. And on that point, I mean, what I mentioned about toxic substances earlier in that correlation, this leakiness can allow toxic substances into the urine. And imagine if you are experiencing dysbiosis, one of the main functions of our gut microbiota is to be a defense system. It's to be a buffer system. It's that nice protective really super organism within you, right, to help you. So if you're ingesting that BPA or some heavy metals here and there or some PFAS, and the list can go on and on, 80,000 plus different synthetic chemicals out there, your microbes are going to take care of you. Now, if your microbes are already lacking, if you already have that dysbiosis and things then start leaking into your bloodstream and your gut is leaky, your epithelial cells all across your body are leaky, it's now up to your kidneys, right? When we're filtering the blood, that's going to be filtered through your kidneys and then out through your urine. If you are having more and more toxic substances in your kidneys, doing damage to your kidneys, and then in your urethra, and then out in your urine, you are doing damage all along the way. So you're creating more inflammation all along the way and doing more damage, and hence the repercussions of that.
Yeah. So like we were saying, there's that intersection with those with dysbiosis or IBS. Some studies have shown that about a third of those with interstitial cystitis also have IBS diagnosed. So there is that high prevalence. There is that high overlap. Other risk factors for interstitial cystitis, like we said, females are a little bit more at risk than males. There's higher prevalence in females. And we also know that having fair skin and red hair, for whatever reason, I don't think they really understand the mechanism behind it, but some studies and some sources have cited that can be a little bit more prevalent. Your age Most people with interstitial cystitis are diagnosed during their 30s or older. So again, like I said, maybe that has to do something. I don't think they really understand that mechanism. My thought process, my theory, and this is just my own theory, is I think it happens to a lot of women after childbirth as well. So I think that sometimes those muscles are weakened, those pelvic floor muscles are weakened postpartum. If someone had pre-existing gut issues, pre-pregnancy, or maybe postpartum, they're starting to find that they have gut issues. What's the big deal?
You just pushed a whole baby out of you.
Man, our bodies are incredible. And I often will have patients say, but I didn't have a vaginal delivery, I was C-section delivery. Again, if you're still a small framed person, you still carried that baby. It doesn't matter if you delivered them via C-section or vaginally. That entire pregnancy that you sustained, that baby was laying there and pressing on your pelvic floor muscles.
Expanding and moving. Lots of expanding and moving going on. So yes.
Absolutely. So females were more at risk. So if this resonates with you, get checked out. Also, those who live with chronic pain disorders. Like we were saying, there is involvement there of inflammation in a lot of these chronic pain disorders, chronic fatigue, fibromyalgia. So there's going to be overlap with other areas in the body as well.
Yes. Yeah. And so, there's also complications. So interstitial cystitis can result in a number of complications. So reduced bladder capacity, so where you're going more often, just lower quality of life. You're more stressed and worried about these things going on, which is normal, right? Sexual intimacy problems. So for couples and just those experiencing this, it's not fun. It can alter you mentally. It can alter your relationships mentally and physically. And that, of course, leads to emotional trouble. So all of this is very, very important. That's why we're touching on this topic and relating it back to your gut health. And again, if you're enjoying this information, subscribe if you're watching on YouTube, or make sure you're liking this on Facebook, YouTube. If you're in our group, great. We're going to get to your questions.
And we wanted to talk about solutions, because we've talked about what the problem might be, why it might be that way, and then what can you do about it? That's something that's so important, because you never want to be saying, I have this thing. It sounds like I have this. I don't know what to do. Should I live with it? Should I just constantly be peeing and, living this way? Not necessarily. So start with one thing at a time. Yeah. Again, sometimes we get patients who are like, I finally know what's wrong. I'm going to try the supplements. I'm going to try the therapy. I'm going to try everything to try to get this under control. You want to try one intervention at a time for the most part, so that way you know what's most helpful and what's not. You don't want to be buying expensive supplements and going for pelvic floor therapy, and maybe the supplements aren't actually doing anything. Maybe it's all the pelvic floor therapy. Or maybe it's, the sling that your urogynecologist placed in your bladder for a bladder prolapse, or you just want to make sure one thing at a time. You want to weigh the risks and benefits of those modalities individually. But treatments that have been proven beneficial are diet modification. So a lot of my patients,
go figure.
Yeah. So this is something I talk about with my IC patients. I'll talk about avoiding really spicy foods and avoiding very acidic foods. So acid can be a little bit irritating to the bladder. So when patients are eating very acidic foods, when they're eating very spicy foods, this can just increase that irritation in the bladder. It's likely not causing it, but it's not helping it feel better.
But disclaimer, this is not medical nutrition therapy for you. This is not individualized care. This is general. And generally, if you're eating doubles and French fries and chocolate cake every day, and then you're like, I better cut out those oranges and that lemon, that's not what we're saying, right? So we definitely don't want you to cut out the healthier citrus foods, especially if you're eating foods you really shouldn't be eating every day. So the foods it's like, wow, maybe I gotta stop with the fast food every day, or the fried foods, or those, especially the saturated fat foods. Those are especially replacing those omega-3 fats that could really, really help you. And those omega-3 fats will be found in seeds, so like flax seeds and chia seeds, walnuts, and other nuts as well as sea vegetables. So those are things you want to mix into your routine before you go, let me cut out the citrus and continue to eat my fast food. Yeah.
So in that same theme though, you want to get your SIBO or your EMO under control.
Right.
So those same things that James was saying are very important. I always say with patients who are gung-ho on starting medications or supplements for things, I always like to remind them, you don't want to pull out your construction team or call up the construction workers to say, hey, come rebuild my house before you've gotten out your fire extinguisher. You want to stop the source of the fire. You don't want to keep lighting matches and then call the construction workers and say, hey, come over and repair my burnt down home.
Right.
You really want to be able to stop it at the source. You don't want to try to intervene right away.
Right.
So you want to try to get a hold and get ahead of your IBS, your SIBO, your EMO, and then start looking also at the same time into other modalities so you can see which one is going to be your first step and work best. And some of those might include, like I mentioned, pelvic floor therapy. So a pelvic floor therapist, like we reviewed in your SIBO care team, they're a physical therapist who's specially trained in helping you strengthen those muscles in and around your bladder and in and around your intestines. So you might want to work with a pelvic floor therapist. I know many who are incredible, and I refer to them extremely regularly with patients on a daily basis. Even constipated patients, I'll refer them to pelvic floor therapy if we feel like there's that need. And they might take you through things. So they might take you through bladder training. They might take you through bladder distension with a urogynecologist. Like I was saying, a gynecologist who specializes in the bladder. They might do things like bladder installation with certain medications. They might use medications. They might do electrical nerve stimulation, bladder surgery as well. So these are all possible things for one to look into if you feel like any of this resonates with you.
If you're watching this now live, or if you're watching this later as a recording on one of our channels, great. You made it this far. Wonderful. We are here for you. If this feels overwhelming, it is. You're not alone. There's a lot to this. So work with your care team, work with the knowledgeable care team. If you want us on your care team, go to marytout.com to learn more. Go for it. If you need to share this, tag this with anybody, go for it. We're just out here educating, putting out some vital information that we're coming across that we go, you know what? A lot of people need this and need to learn more about this. So
I have a question here.
Yeah.
Someone's asking, should I be taking baking soda? I read online that taking baking soda for interstitial cystitis is helpful. Sure. Some small studies have shown that because inflammation and that acidity in the bladder can be irritating, sometimes short-term taking baking soda can help, but you also want to keep in mind, you don't want to take baking soda all the time. Baking soda can neutralize your stomach acid to a certain degree. So if you're someone saying, I'm still eating my fast food and still engaging in these behaviors that I know are irritating my bladder, I'm smoking, I'm drinking alcohol, and I'll just take baking soda, that can be affecting your stomach acid, which is not going to help you heal from SIBO or EMO. So not a good long-term solution and not something that I'd really regularly recommend. I'm all about root causes and not just temporary reactive fixes, for sure. Another question is, if I am taking the medication, do I still need to be doing the different therapies? And again, whether it's a supplement, whether it's medication, and there are some supplements that can be helpful that we sometimes discuss with our patients, but you want to try to really understand why your bladder function might be compromised. So I'm a big proponent for working and connecting with a pelvic floor therapist or a urogynecologist or both. I have often patients who end up doing both. So again, you want to try to look for those long-term solutions, not just those quick symptom alleviations.
Great questions. All right, guys. So happy Friday. Have a great weekend. We'll be back actually next Friday.
Yep.
And then after that, it'll go back to every other Friday. So next Friday, you'll see us again here. If you're in our group, you'll get those questions answered. If you're watching somewhere else, you get to watch and kind of listen in. So it's great. We love you all being here. We love speaking to you all and educating you all. So again, if you want to learn more, marytout.com. You can click below to find out more, and we will see you all next time.
Yes. Thank you for being here.
Bye, everyone.
Have a healthy week.